Let's talk about the tongue. The tongue is one of the 5 sensory organs. It is the muscular organ situated in the floor of the mouth. It is associated with the functions of taste, chewing, speech, and deglutition. The tongue comprises skeletal muscles, which are voluntary in function. Parts of the tongue. The roots, the tips, and the body. The root of the tongue. It's attached to the styloid process and soft palate superiorly, and then the mandible and hyoid bone inferiorly. In between the mandible and the hyoid bone, it is related to the geniohyoid and mylohyoid bones. The tip of the tongue. It forms the anterior freeform end, which at rest lies behind the upper incisor teeth. The dorsum of the tongue. It is convex in all directions and divided by a faint V-shaped groove called the sulcus terminal. The oral part, or papillary part, it is placed on the floor of the mouth. The margins are free and in contact with gums and teeth. Each margin shows 4 to 5 vertical folds called foliate papillae. The surface is superior, it has a median furrow and is covered with papillae. Inferior, covered with smooth mucous membrane, which shows a median fold called the frenulum linguae. On either side of the frenulum, there is a prominence made by deep lingual veins. It also has a fold called plica fimbriata, which is directed forwards and medially towards the tip of the tongue. The pharyngeal part, or lymphoid part. It lies behind the palatoglossal arches and the sulcus terminalis. Its mucous membrane has no papillae, but has many lymphoid follicles, which collectively form the lingual tonsil. Its posterior surface is known as the base of the tongue, and forms the anterior wall of the oropharynx. The posterior part. It is connected to the epiglottis by 3 folds of mucous membrane, which are the right, median, and left glossoepiglottic folds. On either side of the median fold, there is a depression called a vallecula. The papillae of the tongue. Papillae are the projections of the mucous membrane, also known as corium, that give the surface its roughness. There are 3 types of papillae. 1. Circumvallate or vallate papillae. They are large in size, about 1 to 2 millimores in diameter, and a total of 8 to 12 in number. They are exactly in front of the sulcus terminalis. Each papilla is a cylindrical projection surrounded by a circular sulcus. The walls of these papillae have taste buds. 2. Fungiform papillae. These are numerous and mostly present near the tip and margins of the tongue. Some are also scattered over the dorsum. They are smaller than circumvallate papillae, but larger than the filiform papillae. Each papilla has a narrow pedicle and a large rounded head. Their bright red color distinguishes them. 3. Filiform papillae or conical papillae. It covers the presulcal area of the dorsum and gives a characteristic velvety appearance. These are the smallest and most numerous. Each papillae is pointed and covered with keratin, and the apex is often split into filamentous processes. Muscles of the tongue. The middle fibrous septum divides the tongue into right and left halves. Each half contains an intrinsic half. It comprises 4 muscles that occupy the upper part and are attached to the submucous fibrous layer. They alter the shape of the tongue. 1. Superior longitudinal, shortens the tongue and makes the dorsum concave. 2. Inferior longitudinal, shortens the tongue and makes it convex. 3. Transverse, makes the tongue narrow and elongated. 4. Vertical, makes the tongue broad and flattened. Extrinsic, it contains 4 muscles which connect the tongue to the mandible, to the hyoid bone, to the styloid process, and to the palate. 1. Genioglossus, protrudes the tongue. 2. Hyoglossus, depresses the tongue. 3. The styloglossus retracts the tongue. 4. Palatoglossus, elevates the tongue. The blood supply. Arterial supply. 1. Lingual artery, a branch of the external carotid artery. 2. Tonsillar artery, a branch of the facial artery. 3. Pharyngeal branch of the external carotid artery. Venous drainage, deep lingual vein. Lymphatic drainage. 1. Tip of the tongue, submental nodes. 2. Right and left halves, submandibular nodes. 3. Posterior part, upper deep cervical nodes. The whole lymph finally drains into the jugulo-omohyoid nodes. Nerve supply. Firstly, motor nerves. All intrinsic and extrinsic muscles are supplied by the hypoglossal nerve, except palatoglossus. The palatoglossus is supplied by the cranial root of the accessory nerve. Secondly, sensory nerves, lingual nerve and chorda tympani, taste of the anterior 2/3. Glossopharyngeal nerve, taste of posterior 1/3. Vagus nerve, taste of the posterior part. Sensation of taste. The structure of taste buds. Each taste bud is a bundle of receptor cells. It contains about 40 cells, which are the modified epithelial cells. Cells are divided into 4 groups. 1. Type 1 cells. 2. Type 2 cells. 3. Type 3 cells. 4. Type 4 cells. Types 1, 2, and 3 have microvilli that project into an opening in the epithelial covering the tongue. The opening is called the taste pore. The types of taste. 1. Sweet taste, produced by organic substances like monosaccharides, polysaccharides, glycerol, aldehydes, and ketones. 2. Salt taste, produced by chlorides and nitrates of sodium, potassium, and ammonia. 3. Sour taste, produced because of hydrogen ions. 4. Bitter taste, produced due to organic substances like strychnine, morphine, picric acid, bile salts, and salts of calcium, magnesium, and ammonium. 5. Umami, produced due to glutamate, particularly monosodium glutamate. The experience of taste is a dance of senses unfolding in harmonious symphony. As we consume different foods, our taste buds interact with the various elements, creating a burst of flavors we perceive as delicious or repulsive. On the surface of the tongue, each bite triggers a unique set of chemical reactions. The papillae stand as sentinels, each wired to distinguish between sweet delight, salty satisfaction, sour excitement, bitter caution, and umami fulfillment. Imagine a table rich with vibrant dishes, each awaiting to tantalize your senses. The tongue becomes a maestro, orchestrating flavors in a melodious blend of taste and texture. And so, every meal is a new adventure, a journey through the complex landscape of taste, shaped by both biology and personal history.